Welcome to Psychpulse. Sexual disorders. Today's topic is sexual disorders. When you first hear that, you might think of sexually transmitted diseases or other biologically related issues. However, we're not covering a high school sex ed class today. We're delving into the taboo around sex, explaining what sexual disorders are and how they can affect your life. Let's discuss a few rare sexual disorders to provide you with more knowledge to care for yourself. 1. Hypoactive sexual desire. Hyper means a lot, possibly too much, while hypo means less than what's considered average. Hypoactive sexual desire refers to having very low interest in sex. It's normal for sexual activity to slow down with age and to have periods where sex isn't a priority, but some activity still happens. Hypoactive sexual desire, or HSD, is when this lack of interest is persistent and causes anxiety. Ignoring it can create friction in your romantic relationship and become disruptive. HSDD, hypoactive sexual desire disorder, is not just a passing feeling, but an absence of sexual interest. For instance, if someone feels indifferent with their partner but still gets excited looking at a firefighter calendar, it's not HSDD. Biological factors like hormonal imbalances and situational issues can cause HSDD. The good news is that treatment is available. Consulting a healthcare professional can help determine the next steps. 2. Post-orgasmic illness syndrome. Post-orgasmic illness syndrome, or POIS, is an autoimmune disorder affecting those who produce semen. Think of it like allergies. For those with seasonal allergies, going outside without antihistamines is a terrible ordeal. The same goes for POIs. After finishing sexy time, flu-like symptoms appear as an immune response. If you have POIs, your body treats the excreted semen like bacteria, making you sick, and these symptoms show up nearly every time, lasting up to a week post-orgasm. Unfortunately, there is no cure for POIS, but symptoms can be managed by cleaning up after sexy time. With doctor approval, taking appropriate medications can also help. 3. Sexual aversion disorder. Sexual aversion disorder, or SAD, is similar to HSDD but more extreme. SAD has 6 subtypes, and its severity can range from mild to severe based on the cause. While HSDD is about feeling indifferent to sex, SAD involves active fear of sex, manifesting as constant rejection and avoidance of all sexual contact with a partner. As severe as that sounds, since it's a form of HSDD, similar treatments can apply. 4. Coital sphalgia. What's typically felt after an orgasm? Good things like relaxation, warmth, and lightness, what we call the afterglow. But for some, it's not normal. Instead, they get a migraine. Coital sphalgia is an orgasm so intense it triggers a migraine. Strange as it sounds, sex causes stress, but not the type from too much office work. During orgasm, a massive amount of oxytocin and dopamine is released, making it feel good and sometimes causing intense emotions. However, post-coitus, hormone levels drop, but their effect lingers. High oxytocin levels can tighten blood vessels, increasing head pressure and causing a headache. Typically, men experience coital sphalgia, though it can affect women too. While sudden head pain can be scary, it's not fatal. Treatments include taking regular migraine medication and exercising, which can reduce the chance of vasoconstriction during physical exertion. 5. Retrograde ejaculation. Retrograde ejaculation has nothing to do with Mercury being in retrograde. Those who experience it might feel the planet Mercury is at fault. Retrograde ejaculation means your semen flows in the wrong direction. It's not due to gravity or ocean tides, but because of your sphincter, a muscle located at the neck of your bladder. During coitus, the sphincter tightens to prevent semen from mixing with other fluids, like traffic control. Normally, it blocks flow into the bladder and allows sperm to pass through the vas deferens, prostate, and urethra before exiting the penis. With retrograde ejaculation, the sphincter takes a break, and sperm flows where it wants, ending up in the bladder. The sphincter remains on a permanent break, so semen takes the path of least resistance up the bladder neck, which is shorter. Although it's not harmful and doesn't affect your ability to feel pleasure, it can be awkward, especially if you and your partner are trying to conceive. If it becomes a serious concern, consult your doctor for a solution. Sex is a wonderful thing, and knowing more about it can help us recognize when our health is compromised. Bottom line, if you have questions, medical professionals have many answers. Reach out and learn more about this excellent aspect of life. We'd appreciate it if you touched our like button, just saying.